Hello, everyone. Thank you for joining today's Digital BC live stream. My name is Gen Lambert, and I'm the Chief Digital Officer for the province of BC. Very happy to be with you today. Our Digital BC live stream has been on hiatus for a little bit, and we're really happy to be back here today. This is a space where we have conversations with thought leaders in human-centered design and digital service delivery. And it's a great space for us to learn and to spark ideas. So today I am grateful to be joining you from the traditional and unceded territories of the Lekwungen and Wasanich peoples, whose historical relationship with the land continues to this day. This session that we're in now is being recorded and will be posted online after the event. If you like, you can turn on live captions at the top of your screen, right next to the Q&A button. And speaking of Q&A, please do submit questions and take a look at the other questions that have been submitted and upvote the ones that you like. We will do our best in the time that we have today to ask and answer your questions. So without further ado, I wanted to introduce our guest today, Crystal Hall. Crystal is joining us from Washington State's Evan School of Public Policy and Governance. And Crystal is an associate professor there, as well as having recently co-authored a book called Antiracist by Design, which provides a roadmap to an anti-racist approach to applied behavioral science. Now, I myself am not an expert at all in applied behavioral science and found it a wonderful read. It's a great book and highly recommend it. So welcome, Crystal. I feel very privileged to have you here with us today. And could you tell us a little bit more about yourself and how you ended up writing your book to get us started?
Yes, thank you so much for having me today. It's so fantastic to see such a big crowd and what a great time to be having this conversation. My background is in psychology, social psychology specifically. I studied psychology and public policy actually, and with an interest in how insights from psychology and behavioral science more broadly can be applied to the design and implementation of policies and programs. And so most of my research uses those insights in the context of government work and nonprofit organizations in a variety of policy spaces. I got into it thinking specifically about financial decision making and approaches to try to address poverty and inequality. And the book came out of a long-standing conversation that I'd had. This book was co-authored with my colleague and friend Mendy Hernandez. Long conversations that we'd had about how our field doesn't actively engage in questions, often in questions of equity and anti-racism. And in the swell of interest in these topics that really was seeded in 2020, we started thinking about what it meant for our field in particular and the contributions that we might make in particular. And so that really led us to first writing a brief commentary piece, which then evolved into what ultimately became this book project.
That's great. Well, it certainly translated into a great and readable book that I feel smarter having read. So thank you for that. So you and your co-author, Mindy Hernandez, propose a new approach for behavioral intervention design in your book. For those of us who are less familiar with behavioral intervention design, could you give our audience a view into what it traditionally looks like and how the approach you recommend in your book is a bit different?
Sure. So traditionally, when we think about applying behavioral science to complex social problems, we think about a process where we try to understand the decision context, we try to understand what the barriers are, usually these typically psychological barriers, and then we try to design approaches to mitigate some of those barriers that are created by our psychology. And really, on the surface, there's nothing wrong with that approach. That is approach that should work. But I think in practice, what you find is that we're not very good at adequately reflecting the experience of those that are closest to the problems that we're trying to solve. And so very often the people who are designing the interventions, defining the problems even at the beginning, tend to be people that are perhaps the academics or the researchers. Maybe they're folks that work in the nonprofit space, but they're not folks that work on the front lines, so to speak, closest to the problems. And so there are many assumptions that often get carried through from the definition of the problem or the challenge to the understanding of the barriers to an idea of what a solution might look like. And what Mindy and I argue is that that approach is fundamentally lacking in an equitable understanding of these problems, and it doesn't reflect the problems as they might be described by by those populations. And so one of the things that we're really trying to argue is that our practice isn't inherently flawed, but that we can execute it in a way that is more realistically acknowledging all the constraints that are faced, especially by communities that are most marginalized. And so we're specifically talking about anti-racism in the book, but we concede that you can use this approach to think about other groups as well, potentially.
Mm-hmm. That makes a lot of sense. I think one of the pieces that illustrates that piece that you were talking about a little bit about representation and making sure that the folks that are developing the interventions have lived experience, experience on the front lines, etc. Designing interventions so that there is that lived experience within that group. One of the examples in your book that really stayed with me, as I think we talked about a couple of times, is the one on student loans. And I think in addition to the representation piece really stood out for me in terms of making sure that we focus on the outcomes and not necessarily on the task that we have at hand, making sure we always keep our eye on that ball, on the outcome ball. Would you be able to share with our audience a little bit about that story?
Yes, I think this is such a great example. This is one of the examples that Mindy and I really, one of the first examples that we explored in depth as we were conceptualizing how we wanted to approach this topic. And we liked the student loan example because we think it's a space where there are interventions that are really thoughtful and potentially have a lot of impact, but that we often fall short in the extent to which we know that they're working in the same way for the same subpopulations. And so specifically, we were really interested in these interventions that have been on the surface quite successful, interventions which help support students in applying for and accessing student loans. And the idea being that if we can decrease barriers to student loans, then we can decrease barriers to college, we can increase educational attainment, we can increase a lot of other outcomes. And I think the issue there is that we're making the assumption that that's the main barrier. And if we can get over that barrier, there aren't other barriers, or that there aren't disparities in some of those other barriers. And so we ask the question, well, what if we looked downstream? The other issue with those types of interventions is that they're often just looking at that point in time. Do people apply for student loans? And we ask the question, do the students that then matriculate in college and begin that phase of their education, do they actually finish? Because one story could be that, yes, this is great, it decreases barriers, and we would see all of those good outcomes that I just mentioned. The alternative might be that students of color, underrepresented students of color in particular, who we know there's a gap in their finishing college, if we increase the rate at which they borrow, but don't also address other barriers that maybe impact the likelihood they are to finish school, we could inadvertently create a situation where we have more students taking on debt, Right. And this is entirely a hypothetical scenario, but the reality is that with most of these studies, we don't have the evidence one way or the other. And so we use that example as a way to say, a more anti-racist, in this case, approach would be to look further down to see what are the other milestones and do the students of color reach those at the same rate as their white counterparts for this example. And so this is a place where we want to acknowledge the value of this type of intervention because these studies are incredibly important and they're addressing real barriers. At the same time, they might not be adequately addressing some of the barriers that we have good evidence disproportionately impact certain student populations. And so I think this example was one that really helped us envision how we want to think about that and how we want to think about these problems at multiple stages of the process of designing and testing an intervention.
Hmm. I think one of the pieces in your book that you also mentioned is sort of, you'd acknowledge the difficulty of understanding those outcomes and how we might actually get that information, and sort of talk about the difference between qualitative and quantitative data and
Mhm.
when we might use one versus the other. I think in the public service here, we're certainly learning more about the use of qualitative data as well as quantitative data and really leaning into gathering those and analyzing those to get outcomes. Would love to hear your perspective on that.
Yes, I love that, and I think it's so important to not undervalue qualitative data. I think, often there is this narrative or assumption or this lay understanding that, quantitative data is more rigorous and more valuable. And I think that couldn't be farther from the truth. And that's coming from someone who I'm not trained in qualitative research methods, but I think the way that qualitative methods complement quantitative insights is so valuable, especially when we're trying to understand the experience of groups that are often just less represented in the spaces that we're examining. And so I think that the qualitative insights can provide such an important tool to help us make sense of that. And I think it's useful to think about that again at all stages. That can be not only just in designing an intervention, where I think we might think about it, or even evaluating the intervention, but sometimes in defining the problem in the first place, right? I think often researchers like me, we use administrative data. We lean on administrative data so much in terms of trying to understand where there might be disparities in outcomes. And again, that's very valuable. If we are able to find spaces where we add in qualitative insights at that phase, we might catch things that we might not otherwise understand and understand why there might be groups that are very, very different that might be just connected and lumped together in a way that's much less productive. So using the qualitative insights to help us understand the definition of the problem, to understand the barriers, moving through the process of then designing an intervention and testing it. And so I think it's so critical, and it's something that I see more and more this evolution towards a genuine valuing of both of those. And I think that that will be a really important step for us to continue to take in this type of work.
Hmm. Yeah, I'm really seeing a maturing of those that perspective in BC Public Service as well.
Mhm.
We have our first question from the audience.
Great.
So the question is, what might be some challenges to encouraging more researchers to use an approach that centers on the perspectives and experiences of marginalized groups?
Thank you for that question. It's a really important question. I think um, perhaps unsurprisingly is resources, right? It takes more effort to do it well and to do it authentically and to really do it without creating significant burden or additional harm. And so I think to do that, we need resources, we need time. I think the other challenge, and I know I face this as a researcher constantly, is like often grant cycles are very short. And so if we want to implement some type of study, there's often a rush to do that without the time we need up front to be clear that we're defining and approaching the problem in an appropriate way at the outset. And so I think really recognizing that it takes more time. And I think to me, it's also important to acknowledge that the benefit from taking that time is that we are more likely to do something that works. And so I think, this is where we get into a space of thinking about, doing this work. We're not doing this work just to do it for the sake of doing it. It's because it will make the other resources that we invest more effective. And so that's the message that I also like to give, is that this is very important so that we're being effective and efficient with limited resources. And so I think the investment of really taking the time to understand the context, to understand some of these populations that haven't been explored in this way and where assumptions have been made, there's a real cost to that. And so taking that time, making that initial investment, I think pays off when we can be more effective with the way that we allocate resources, often very scarce resources.
Yeah. Yeah, and I think that kind of goes back to that example, right? And focusing on outcomes. Like we actually want to achieve the outcomes that are in front of us that we're aiming at. And at the same time, sometimes the sort of ideas and tasks can get can go above that, so the sort of
Mhm.
the looking at the outcome, and so making sure that we're keeping our eye on that, providing the time that we need to in order to get to that outcome can actually help us with efficiency of resources
Mhm.
to get to the outcome again. Yeah,
And
that's great. Um, so we have a few more questions in here. One of them is, how can we honor the feedback of marginalized communities when designing and implementing policies when we are part of a large hierarchical institution? So maybe that goes a little bit back to the qualitative information as well.
Mhm. Yes, it's difficult. I mean, I think one point that this question raises for me is just the need for authentic relationship building. And when we're working with partners, really taking the time and the effort. And again, this comes back to resources and often time as being a big resource, is that really acknowledging that often these are communities that have historically traditionally been harmed, right? And if we come as a member of, and it doesn't have to only be a government entity, that could be, it could be a large nonprofit entity, it could be another type of organization, but often I think that history is not adequately respected. And so really acknowledging the value of engaging in genuine relationship building, I think that can make it feel much more productive for everyone to deeply engage, especially when we know that, resources are limited and things don't always go the way that everyone wants, right? In these situations. But I think if we can take the time to build relationships and to listen and to like really genuinely listen, I think that goes really far. And it's not, again, all of this I think is easier said than done, but I think it's still a very valuable place to just think about, like, where can we find opportunities to pause and listen, and again, seeing that as an investment in what hopefully can be these long-term relationships that we want to have with the folks that we work with and the folks that we serve.
Hmm. Yeah, and I think the relationships and trust kind of go together, right? If we
Hmm.
want to continue to be gathering that qualitative information from folks to inform what we're doing to provide the good outcomes, or to work towards the good outcomes, then we need to make sure that we have that trust
Hmm.
through that relationship building,
Hmm. Hmm.
following through. Um, interesting question we got here. Were there misconceptions about anti-racism that you hope to challenge or explore through your book?
Oh, I love that question. I mean, I think it was interesting, as we were doing the research for this book and we were reading things that we read that we had never read closely or rereading things. I think what really struck me as I thought about this as a behavioral scientist, as someone who works and under this hope that this is work that makes what we do more effective, right? The idea that, the popularity of applied behavioral science came out of this idea, came out of, the book Nudge was like such a big catalyst, this idea that we can take these insights about human behavior and human psychology and we can improve the way that we all do our work. And I think when we get into the anti-racism space, it can be really easy to slip into this narrative about, you know, doing this work for the sake of checking boxes or for the sake of doing it because you want to signal some type of value. And I think what we really want to argue, and I don't know if this is exactly about a misconception, but I think this goes back to a point I made earlier, is just that this is necessary so that our work is more effective. And you can just find so many examples of places where we do this work and it works in some cases and not in other cases. And if we can take the time to be more nuanced, then we're more effective. And so I think that's a big misconception of a lot of work that falls under this like big umbrella of diversity and inclusion, equity, whatever, however we want to describe it, is it gets lost at the idea is that this is necessary for us to effectively do the work that we have to do. And so that's something that we've really wanted to stress, and that message feels even more important now. As we navigate, the state of the world, right, as it stands today.
Mm-hmm. So you spoke a little bit about nudge, and I'm going to ask one of my questions here.
Sure.
That's okay, audience. So I really found your description of nudge and its focus on the individual rather than structural or systemic
Mm-hmm.
factors really interesting. I hadn't really thought of that before.
Mm-hmm.
Um,
Mm-hmm.
but you have some great examples of behavioral design interventions that do take into account those structural factors so that you can still create those interventions that work better for people and aren't just about um, nudging them
Mm-hmm.
individually.
Mm-hmm. Yeah, I think this is a really fundamental piece of our argument. And I'll say we have not been the only folks to make this argument in the field recently. There's been some great work, and we reference this in the book by some other scholars, George Lowenstein and Nick Chater, that talk about the way we approach individual versus systems level interventions and approaches to different problems. And they argue that when you focus too much on the individual, that can potentially erode support for systemic approaches to address problems. And they talk about, someone who reports engaging in a lot of individual climate friendly behaviors. There's some evidence that shows that they may have less support for broader policies around the climate crisis, for example. And I think it's a really interesting argument. And I think it's complementary to ours. I think it's a little bit distinct because they don't make the same type of equity argument that I make, but I think that both of the arguments that we make are important. And when you look back at books like Nudge, and I mention Nudge and we mention Nudge not to pick on it because it's an incredibly important and influential book, highly, highly influential on both of us, we can still look at that through the lens of thinking about systems and ask the question, okay, we can identify these individual psychological factors, but what else is going on? And how can we think about designing interventions that might address some of these other types of bigger systemic features as well? And often recognizing that the way that those systemic forces operate looks different for people of different groups, whether it's about gender or race or something else. And so I think it is a really fundamental piece of our argument. And I think we try to be very clear that we are not suggesting that we abandon that focus on individuals. We're saying we should complement that with realistic, I would say, understanding and acknowledgement of the impact that systems and structures also have on our behavior.
Mm-hmm. Yeah, the story that you had in the book that really brought this home for me was the one around prenatal care,
Mm-hmm.
and the sort of the reminders, which would be the typical nudge intervention, and then why that might not work for some folks, and why other interventions could work better, based on the sort of experiences that they'd had in their lives,
Mm-hmm.
other than that. So that, I found that was really powerful. I don't know if you want to share a little bit more about that story.
Yeah, yeah. I think that this was just this example that, there's a lot of emerging evidence, and some of it comes from some of my colleagues at the University of Washington showing the different impact, the health outcomes of women of color, Black women in particular, and other mothers, and the idea being that it is tied to the impacts of dealing with racism in the world, being a woman of color in the U.S., and arguing that there are, it goes beyond nudging people to, make it to your prenatal appointments or take your prenatal vitamins. We talk about some fantastic work in providing doula care to help patients advocate for themselves and helping them engage in a system that often has not been set up to make them feel welcome and included and seen and heard in the same way. And so I think it's a great example of a place where you can imagine interventions that are going to do both, that are going to think about those individual level features and forces that often have an impact on our behavior, but also recognizing that the systems at a very high level look very different in this case, based on race and the outcomes, and that there's objective data that the outcomes are worse for those women as well.
Mm-hmm. So we have a great question coming in around sort of outcomes and what we do beyond research. So the question is, how can designers, policymakers, and digital service teams actively dismantle systemic racism in their processes, ensuring meaningful impact beyond research and testing?
Yes, I love this question as well. I think one thing, just I'll give one example that really has stuck with me when I think about this type of issue is I think we can think about how do we disseminate findings from research. And I think often, we engage with communities to conduct research. And even when we do it respectfully, I don't think we always come back and do effective dissemination in communities in ways that will be valuable to them. And I was really fortunate to participate in a study here at the University of Washington. We had folks from a variety of departments looking at how youth engage in active transit in the South Seattle community. And one of the most exciting things about this project, there were a lot of exciting things about this project, was that we engaged in some really great community sessions when we were disseminating the results to share what we found and to receive feedback. And it was very non-traditional for an academic research team to disseminate in this way, but we really wanted to authentically return back to the community, thank them for the support, and share the findings in a way that we thought would resonate with those that had the most potential to be impacted from them. And so I think that there's, as a behavioral scientist, when I think about the way that we traditionally conduct research, I think there's so much potential in being more effective with how we disseminate the findings. And I think that that could go a long way to helping us break down some of these historical systemic issues in the way that we engage and the impact that is then shared or not in those
Mhm.
spaces.
Well, I definitely found your storytelling approach to disseminating some of those findings really effective in your book. So maybe that's one of the ways too. A related question I think here is, this comes from somebody who does this kind of work, it looks like. Much of the work that we do is with very marginalized people with very little time or ability to take part in research. How would you go about getting these individuals' perspective?
Yes, this is another one that's really difficult. I think we have to be really mindful about when we are asking others to support us in the work and when there are places that we can do some of the learning on our own. And I think it's really hard because often we don't know what we need to know or we don't know what we don't know. And so I think in my own work, I've just tried to be really careful about monitoring, like, who am I asking? How often am I asking? Am I doing what I can to support them or compensate them or make it easy for them to participate in the research? But I think it's something that we have to be just constantly paying attention to. Like, has somebody come to them recently? Um, do we anticipate wanting to come back to them? And if we do, does that change what we ask now? So I think just really being so mindful of that. And again, being realistic about what are the resources that are needed to try to support those marginalized folks in their ability to participate and showing that their perspectives are valued by allocating resources towards generating them. But it's I think it's one of the hardest pieces of this is that it's not just about the time or ability, as you mentioned in this question, but also just about trust. Like, there are communities that say, like, I don't trust you, often with very good reason. So it's hard, and I think that's where, building a culture of relationship building in the way that we conduct research, I think, can pay really long-term dividends. But it's a long-term approach, but I think a one that's very worthwhile.
I think some of the things that you just spoke about kind of point to another piece that the work is hard, and how does one um, in your field of work put the oxygen mask on first? So there's a question around how can researchers practice community care and apply a trauma-informed approach, not only when working with participants, but also for their own well-being, given that the work often involves emotional labor and can be deeply personal.
This is one that I struggle with constantly. It's really difficult. I think we have to be really mindful about how we are putting ourselves into this work. And I think, and that means, not saying that we shouldn't be. There's a great a colleague and friend, Anthony Barrows, wrote a really fantastic piece a couple years ago about how lived experience is so important in doing the type of work that we do, and it's often undervalued or underappreciated. And I think there is this balance of, trying to really honor the fact that often our lived experience brings a lot into this work, and also it can make this work more exhausting. He's done some great work in creating this, what he calls, a network of intersectional professionals, and these are folks that often have lived experience. And so one of the examples that he uses is people that work in foster care that have been a part of the foster care system, have that experience. And so I think one way that we can support ourselves is creating networks like those where we can get support from those that understand it. And then I think also, if you work in a space where you don't have lived experience, recognizing and supporting bringing in folks that have it, and then being someone that can support facilitating the support that those folks need, right? I think often that is so much more powerful if someone that isn't a member of some of these marginalized groups can speak up and help others understand the value. I think that can be really important as well. But it's really tricky, and it's something that I think many folks struggle with working in these spaces.
Mm-hmm. So the importance of community and learning from each other, supporting each other,
Hmm.
folks that work in the space.
Yeah.
That's great. Um, It's a good question here. How can BC agencies and public servants, or how can agencies and public servants generally balance inclusivity with the constraints of slow changing government structures?
Oh, this is also an interesting one for me to think about in the moment that we're in right now, being in the US. Um, I think, I think as I think about this, and obviously I'm in the US and I have a lot of experience working in the US government. I think one thing that I've really found is, my background is in academia. I went through school, went to graduate school, got my faculty position. And it wasn't until about 10 years ago when I spent a year embedded in the US federal government working with the social and behavioral sciences team that I really worked alongside these most often career civil servants. And I think the thing that I was reminded of again and again that, these are folks that I think there's such a and I'll speak for the US only with this, but I think there's just this narrative that, that these are folks that are there and they're like things are grinding slowly and it's because people don't care or they're motivated to see that happen. And that was not my experience. I think people are there and they genuinely respect the populations that they serve and the job that they have to do. And I think when we can honor that and celebrate that, I think that gets us really far along the way. And like not having these assumptions that people are there to make it difficult for the sake of making it difficult or make it difficult for certain groups. Like that has not been my experience. And so I think if we can if we can change that narrative and think about how we support those folks in doing those work and then also valuing their opinions. I think the other risk we run is that an academic comes in to work with a government entity or a nonprofit and they bring in their ideas of what the problems are and they bring in their ideas of how we address them. That can be problematic as well. So recognizing the expertise that public servants hold in these spaces, I think is another way to create another form of inclusivity that's really important. And I think when we can do all of that and we can find common ground in some of those spaces, I think that can help speed things up sometimes. That can help things go more smoothly. And then also, often governments have to change slowly, and that's not always a bad thing also. And I think that's another thing, that's another lesson that I learned is like there's a function often to that, and it's not about going slow for the sake of going slow. It's going slow often to protect the integrity of the work and protect the groups that we serve. And so I think really approaching some of these with some of that, and I know that like what I'm saying is probably not like news to many of the folks that are on this call, but I do think for the academics, I think that's a big mindset shift that I think can have a big impact. And maybe perhaps also thinking about, another equivalent is respecting the expertise of the people that work closest to the work that's being done, the populations that are being served, and the perspectives that they bring can also be really valuable as well.
Mm-hmm. It's interesting how many of the questions and sort of the thread of time has gone through this conversation. Like, how fast and how slow do we need to go? We have a question around agile environment. So we have a big move in BC government that has been ongoing for years to move more towards agile. And being able to deliver smaller increments more quickly and being
Mhm.
nimble and able to change. Um, Understanding that the work of applied behavioral science does take time, working with communities takes time. How might those pieces be married together? And have you seen sort of examples of that in the field of being able to deliver insights on a regular basis to inform the approach?
Yeah, I think this is where there's so much value in having entities within government that's their function, right? Their function is to test quickly and translate and deliver the results of those tests. And it's I will recognize somewhat my bias there because this is the type of work that I've done in the US federal government. But I think that's important because I think that there's a very much a there's an opportunity to again like respect the need for some slowness for big changes, but also to be innovative and to test and to make sense of like, okay, in this particular context this might be different than this context, or for this particular group things might look different than for this other group. And I think that is something that, like, as a behavioral scientist, I feel like the emergence of a behavioral science as a tool for public service in that way, I think is really fantastic. And that's been so much of what I've focused on in the last 10 years. And I think it really can help find that balance. And so I think preserving those types of spaces and valuing those types of spaces, I think, is really important in the long run. And that's, you know, the support for that shifts. But I think it really does help you kind of meet in the middle with some of that.
Mm-hmm. That makes sense. And I think testing is so much an important part of Agile as well as an important part of behavioral science. So
Yes,
it
yes.
does actually match together quite well.
Yeah.
Yeah, that's great. A question here around what we each can do ourselves. There's a question around, do you have any recommendations on how people can begin the process of self-reflection around being actively anti-racist, especially as it can feel uncomfortable as we start down that path?
Yeah, I think just doing the learning, reading, you know, and I think this isn't just about reading about anti-racism, but if you're working with a particular group and you don't share that experience, doing everything you can to learn about the experience of who you're working for, who you're working on behalf of, I think is really important. And I think also just not being afraid to put yourself out there and to try and to ask questions, because I think we get into these loops of being worried about saying the wrong thing or saying the thing in the wrong way. And so I think just starting to do the work. We in the book we have a section that we call prepare, which we describe as being what we do before we do any of the work, right? So before we even define the problem, pausing to think about, okay, when we think about anti-racism or with equity more generally, what are the goals? Like, where are our potential blind spots? Where have we made mistakes in the past? What's the history? How do we want to think about that? Pausing there to really be realistic and honest about the goals, I think can really shape the rest of the process. And so I think there's the work that we can do of that internal self-reflection nature, but I think that can also carry over to the way that we approach our work with groups who we may not share some of these really important identity characteristics with. So I really I love that question. And I think the other thing I would say is I think also everybody has a space where they're uncomfortable here, right? Like nobody's an expert in every type of experience. And so no one is safe from making a mistake, I guess, so to speak. And I think that often this dangerous narrative emerges of, you know, those who kind of know what they're doing in these spaces and those who don't. And I don't think that's fair. I think everyone has some experience of their identity being underrepresented, and everybody has some way that they have a blind spot with that as well. And so I love to give the example. My children go to a public school that is the school for kids that are deaf and hard of hearing. And I have learned a ton about accessibility for that population through my engagement in the kids' school. And this is something that I never thought very seriously about. And now it's something that I pay attention to a lot. I think about when people speak over each other in meetings, or when people speak with their back turned so that people can't see their mouth. It's changed the way I teach. And that's just one space where I just by chance, my kids are not deaf or hard of hearing, but that's just a space that I've happened to learn about, that I realized like, oh, I've had this blind spot. I've spent 15 years often lecturing at a whiteboard with my back to the class, and there may be people that can't hear me as well. So that's just one example, is that I think we have to be open to the reality that we all have these blind spots, and they're going to emerge for us sometimes in ways and in spaces that we don't expect.
Mm-hmm. That was a great, I think, last question. We have about 1 minute left. I want to thank you so much for being with us today here, and thank the audience as well for the great questions. I learned so much. I know that folks in the audience as well learned so much, and I think folks will be coming away with some thoughts and ideas as to how we can put some of what you talked about into practice. So thank you so much.
It was a pleasure. Thank you.
Yeah.